And now some very dry material brought to you by Jessica Chambliss. For my clinical project, I put out a survey on SurveyMonkey that wanted to get some opinions on nurse-to-patient ratios and patient safety. What I found was quite interesting. So Morgan Lunsford and I decided that we would do our Capstone project on the very same topic. The study used a qualitative descriptive correlational research design that utilized an anonymous survey to retrieve data regarding views on nurse-to-patient ratios and the relationship on patient safety. Participants were obtained using purposeful selection of healthcare professionals who were directly related by nurse-to-patient ratios. The results of that survey are presented now. The survey consisted of 27 respondents. 66% of those respondents were registered nurses. The rest of the respondents consisted of licensed practical nurses, charge nurses, travel nurses, and other respondents. The survey asked respondents to identify their current specialty. The specialties represented were surgery, OB, non-surgical medicine, intensive care, step-down, emergency department, rehabilitation, pediatrics, psychiatry, pharmacy, administration, hospice, and corrections. When asked the question, do you feel nurse-to-patient ratios have an effect on patient safety, 100% of the respondents stated yes. Question number 2 asked, do you feel your unit has a nurse-to-patient ratio that is conducive to patient safety? 42% said yes, 57% of the respondents stated no. Question 7 asked, do you think the nurse-to-patient ratios affect HCAHPS scores? 96% said yes, 3% stated no. Question number 8. Does your facility focus more on HCAHPS scores or employee patient safety? Or do you think both issues are evenly addressed? 55% of the respondents stated the focus is more on HCAHPS scores, 11% the focus is more on patient safety, and 33% felt that the focus is on both issues evenly. We asked 27 respondents to briefly describe a personal experience in which a patient was put at risk due to a high nurse-to-patient ratio. This is what they said. Due to high patient loads, it gives no room for emergencies. At its worst, a patient in distress would have to wait longer for a nurse working out of their area to come and assist because their nurse is overloaded and hypothetically drowning themselves. Another respondent stated, my unit has experienced a dramatic increase in patient falls since our nurse-to-patient ratio has increased due to short staffing. There has been at least one fatality directly related to a patient falling and being short-staffed. Another comment, confused patients on bed alarms that are jumping out of bed while trying to take care of 4 other patients, 2 more who are confused. The sheer increase in probability of fall is much higher with a higher ratio. And finally, there are so many, it's hard to narrow it down. The one that sticks out in my mind was the day that I had 7 patients, 3 of them getting end-of-meal insulin coverage and 1 needing 2 units of blood. A total of 4 of the 7 had AccuChecks, and 1 diabetic not on end-of-meal coverage still needed sliding scale coverage. Decisions had to be made when so many tasks are required of a single nurse. No one was harmed. The potential was there. The struggle was real. As you can see by our study, it does show that there might be a direct correlation between nurse-to-patient ratios and patient safety. There are some limitations, however. The sample size was quite small, with only 27 respondents. And it being a qualitative study, the results are more subjective. However, as you can see from our literature review, there is quite a bit of research on this subject matter. More research, however, is needed in order to make nurse-to-patient ratios a matter of law.